Hey, this is Dr. John McCormick, and I'm here with John Wileman from Excelsior Higher Care. And they're one of the partner plans with us here at Ovation. And today we're going to dive into a subject. I'm not going to say it's super exciting, but it's super important. I mean, it's really one of the things that cause people to have higher healthcare costs or get sicker than they should or whatever is that barrier we have to that initial care that they need. And one of the things that has come into the table really in the last decade is telemedicine. All right. And telemedicine is so valuable. And, as bad as COVID was, and as traumatic as that was, what it really did was kick the doors open and expand the ability for telemedicine to be used more broadly, which gave more access to more people quickly without having to go to the doctor, without having to sit in a room full of sick people, and get the care they need really in a very rapid kind of way, right? Unfortunately, they just announced that telemedicine was no longer going to be covered as a component in the Medicare space. And that got me thinking about, some of the other plans, commercial plans that are out there that also include telemedicine, but as part of their telemedicine access, they also have this additional burden. There's a copay or there's some kind of deductible or something else. So is it really the dynamic plan that it needs? So I want to give you an opportunity, John, to talk about that a little bit. How is the Excelsior plan different in how how the member can engage telemedicine through your plan?
Great question, Doctor, because this is one of the many differentiating factors for Excelsior. You could say that this is one of the most important and certainly one of the most innovative. Most plans now are charging a large copay, or they are including the telemedicine within the deductible. So I'm aware of many charges where people have had to pay the full amount that they would have paid for an inpatient visit for a telemedicine visit, with the only benefit of them getting care quicker. At Excelsior Higher Care, we don't want to have any barriers. We want them to get health care quickly and affordably. So
what is the cost? So what is the cost of telemedicine through the Excelsior Higher Care plan?
Zero.
How about for the high deductible plan? I mean, I know y'all have a platinum level plan and a high deductible plan. If I'm on the high deductible plan and I need telemedicine, what's that going to cost me?
Well, we don't like to call it a high deductible plan because it is very different from every high deductible plan on the market. High deductible plans have a huge deductible, then an even larger out-of-pocket maximum, and everything goes into there. There's co-insurance, et cetera, et cetera. Our hybrid plan, which has a deductible component for certain services, including for certain services, does not charge for telemedicine. So it is a zero copay.
So it's pre-deductible. So I can get my telemedicine without having to pay anything. It's included.
It's aside from the deductible. Like it's a new terminology. They used to call it pre-deductible. I'd like to call it aside. There's no copays for telemedicine, no copays for primary care, no copays for specialty care, no copays for diagnostics and imaging. So again, we are making it so that people can get access to care and get care quickly.
One of the things I talk about all the time is when we create barriers to what you described, which is I call core care. Mm-hmm. When we create barriers, as a health insurance industry often does, what you're telling somebody is, well, you're sick, pat them on the head, and if you get really sick, then we want you to come back, because if you get really sick, then it might be worth it to you to spend $50 or $75 to access our care. And I think that's a terrible message. One, because you should always have access to that core care that you described without any barriers. Because if I have a barrier and I go, you know what, I just, it's I hadn't got paid yet. Payday's not until Friday. I really don't know. I really need to put some food on the table, and I don't have $50 or $75 in my pocket, to go do that. Then I wait, and now my, what was a little bit of coughing and cold now becomes pneumonia, and now I'm in the hospital. I'm actually costing the plan more money. It's impacting my work. If I'm an hourly worker, I'm now losing time at work. When had I had access to that zero copay, zero basically free included in my plan telemedicine, where I could have got a prescription over the phone and gone and picked it up within an hour. I mean, that's amazing.
And I think that's one of the most important parts, which is why we don't like to call our other plan a high deductible, because deductibles prevent people from getting care. So our deductible really is a method of paying less on one plan than another, depending on your genetics and what stage of your life you're in. Either way, we look at care, the core care items, as critical for everyone. And the advent of telehealth, and extremely accessible telehealth. I mean, sometimes the phone response is 20 seconds or something?
I mean, I've used it myself, and I've used the plans that are in our contracts. And I can tell you the longest I've ever had to wait for a physician to call me is 8 minutes.
Yeah,
I mean, that's faster than me checking in at my primary care
right,
doctor.
right.
I mean, I can hit my app, punch it in, and generally within just a couple of minutes, I'm getting the doctor will be calling you. Please wait, or this is blah blah nurse.
Mm-hmm.
Please stand by, and I'll connect you to the doctor. And you're like, wow.
And our family uses it all the time because it is such a time saver to not drive, to not park, to not wait. But as everyone knows, it's hard to get to see a doctor these days. And if you have a cold, it's not critical, so you're going to go and sit and wait. But telehealth, again, no copay, no charge. You do that on the app, you get taken care of, and frequently they'll send you right to the pharmacy. You get this, and let's say it is something serious. Well, maybe you should go see an urgent care. Maybe you need to go do this. Well, thank goodness, because if you hadn't gotten care and you couldn't get into your doctor's office, you could end up in the emergency room or worse.
Absolutely, absolutely. Well, I mean, today I really just wanted to target that. It's kind of one of those hot topics because it just came up, and all I could think of is the population that engages in healthcare the most, which is our Medicare population. They are now putting a barrier up, and it just kind of blew my mind to go, I get it. I mean, I hate to say I'm an old folk, but I mean, I'm a recent converter to telemedicine. I was kind of a holdout in my office to be one of the last converts, but now I'm never going back.
Well, yeah, and if you
I'm
look
never
at
going back.
if you look at it, 10 years ago, maybe the senior society was starting to adopt technology.
Right.
But if you talk to them, I can tell you my mother is better in technology than I am. And her friends, they've got everything wired. So they research everything on the internet, and they talk about that. Well, I found this, I found that. Telehealth is perfect for them because they all may not have driving access either.
Right.
But what about weather, driving access? So I want my mother, I think everyone would want their grandparents to be able to call up, get a quick appointment, and not worry about, oh, well, we could do $50 as a copay. I have to pay a deductible, or I could have my family over for Sunday dinner. We don't want anyone to have to make that decision. And at
Absolutely.
Excelsior Higher Care, they do not. $0.
Absolutely. And that's so valuable. And just as a side to that, we do actually offer telemedicine as a standalone benefit that you can get. So if you're in one of these plans where you're paying a copay, or you don't have access because they've removed it, you can actually call us at 866-549-4199, and we can actually give you that telemedicine option as a standalone benefit. So
People will probably use that more than their other.
I think it's amazing. Hey, well, thank you so much for coming.
Thank you, Dr. John.
All right.
I appreciate it.
You bet. Have a good one.
Thank you.